And our next speaker is going to talk about something very, very close to my heart, something that I hope in my lifetime we can cure. I think we've made great strides. I think that this is a real merger of science, medicine, and the human spirit. So Joy Phumaphi, of the African Leaders Malaria Alliance, will be speaking to us now. Thank you.
Thank you so much. I'm the last presenter before lunch, so I'll try to be as brief as I can. I'm not from the private sector, so I've never worked in the private sector. I've worked with government and with development agencies, but I've always had a deep respect for the private sector. And I believe that the concept of shared value is actually a concept which all humanity shares. And as somebody yesterday said, it is logical. It's common sense. And I think it is high time that we did appreciate that, at least at this stage in our civilization, we should be using our common sense as much as we can. Given the challenges that are facing us. You'll see that I've got a stethoscope there and a few charts. That is not just a decoration. The stethoscope, I think, demonstrates to the extent to which shared value should be the pulse of sustainable development. And I think the charts there also demonstrate the matrix that actually guide this path, so that you have to be able to measure it. And I think we heard earlier on about how important it is to be able to measure the pulse of anything, particularly a human being. So what I'm going to do is just talk to you about our experience in the development arena, giving an example of the organization that I work with, which is an initiative which was set up by African heads of state and government. My bosses are currently 49 African heads of state and governments. And then say what the implications are given this for the SDGs, and then a very brief opinion that I'm going to give about what the implication for sustainable results. Now, I work with an organization called the African Leaders Malaria Alliance. It was set up by President Jakaya Mrisho Kikwete of Tanzania. The current chair is President Ellen Johnson. Sorry, Ellen Johnson Sirleaf was the third chair. The current chair is Prime Minister Haile Mariam Desalegn of Ethiopia. And this is the type of reporting that we do for the heads of state. It's a basic matrix focusing on malaria, but also focusing on maternal and child health. I don't think it's necessary at this point to go through everything, but it shows all the member countries there and the indices that we are tracking for the heads of state and holding countries accountable. This is our current chair. What the matrix does is enables more focused attention on the interventions that are necessary to control malaria by the heads of state, so they can support their ministers properly and hold themselves accountable as well, and their populations hold them accountable for delivery. It strengthens the country health management system. It improves performance and policy visibility, for the people that the governments are seeking to serve. And it increases accountability and transparency. This is information that is available to NGOs, civil society. On our website, everybody has got access to it and can see, how their country is performing and what recommendations have been made, how they can improve performance, and whether they're actually doing it or not. And we deliver quarterly reports. We produce this data in partnership with all the rollback malaria partners. That includes civil society groups, private sector, the multilaterals, countries, everybody who is involved in the fight against malaria. So we try to be as transparent and as functional as possible and focus on action and on results. Areas of underperformance, once they've been identified, become the responsibility of everybody to resolve within the partnership, and we make sure that people participate in this. So it is a continuous feedback cycle, monitoring, engaging, acting by all the partners involved. And we have seen that since the introduction of this mechanism, the progress in the fight against malaria on the African continent has really accelerated in the past 5 years since we introduced this. During the past 2 years, we tried to introduce the same approach, but country by country, in 23 countries for reproductive, maternal, newborn, and child health. As you hear, it is in the past 2 years, so there's not really been enough time for this to have an impact on the health MDGs. But the countries that are actually operationally using this mechanism at country level are finding it to be extremely rewarding. Now, what is the implications for the SDGs? I think earlier on you saw what the SDGs look like. It looks like a lot of global priorities. But what I love about the SDGs are that these are the people's goals. And if we are going to be talking about sustainability as a form of shared value and a shared value system that all of us own, then whatever we do has to be owned by the people. And the beauty of the SDGs, unlike the MDGs, which were developed by the multilaterals, the SDGs were developed by the people. So they are the people's goals. And being the people's goals, I think I would like to go back to remind ourselves about what actually defines success or a successful human being. A successful human being is a human being that has been converted into human capital. And once a human being has been converted into human capital, they have a skill that they can sell. They've got experience that is valuable, that is attached to that skill. They've got abilities that organizations and corporations want to be able to exploit. And then they have capacities to apply all this experience, all this education, these abilities. So that is what defines human capital and what makes it valuable. Now, if you are an employer, you hire people because they have primarily the first two, of those the qualities that you are looking for that define human capital. And later on, you are able to observe the third one, that is the ability. And then you usually pray that they have the capacity to apply all this. And you don't really explore that as a dark area, whether you are a CFO or a CEO or a HR manager. It's very dark, and you know nothing about it, you have no control over it, but you just pray that the capacity is there. And I think what we've been talking about these 2 days is that one very important element of the capacity is the health and well-being of that human capital. And you do have control. And I think this is what the challenge that we are putting to ourselves now, is that you do have some control over enhancing that capacity at least, and not leave so much to prayer. For those who are Christians anyway, God says they help those who help themselves, I'm told. Now, if you look at what governments have been doing in this space, trying to address this particular area in which we are trying to not to just pray, but to help ourselves as well, you can have a legislative framework that mandates all of this. The businesses institute family-friendly policies, health insurance plan for all families, tax breaks and subsidies as incentives. The governments can provide public funding. There's a list. I mean, it's endless, and it is not inclusive. But the question is, as a CEO, as a CFO, as a manager, as an owner, a business owner, are you going to wait for your government to do this? Because you now know that you yourself can actually increase the value and limit the amount of prayer that is going to determine the quality of your products and the productivity levels within your company. Are you going to leave this people's agenda to the government? Or what is your role? Because this people's agenda is actually defined by that human capital that you want to be able to produce at its best capacity within your organization. These goals apply to that individual whom you want to drive your organization. They are not goals that apply to somebody in country X. They apply to someone in America, they apply to somebody in Rwanda, they apply to somebody in Papua New Guinea, they apply to somebody in Bangladesh. So what are you going to do? And what are you going to do with the targets under SDG 3? I think we spoke a lot about the various elements of aspects of health that you can engage in. And I will not rehash the importance of measurement and the importance of using data and the importance of the matrix. I'll take that as a given because I think other members of the panel talked at length about that. This is a continuation of the targets under SDG 3. You can see how extensive they are. But what is good about these targets is that they give you an idea of what it is that people around the world are interested in, are concerned about, that is going to determine their productivity levels and their ability and their capacity to be able to deliver your product or your service and operate optimally. So my point here is that during the SDG era, when we are going to be following a shared value, a shared value approach to development and to the running of our companies and to making approach to making a profit, is it not time that we ensure that our corporate strategy reflects this shared value, and that the corporate strategy is not handicapped by the myopic, the myopia that has defined the pre-SDG era, where we looked at the first three bottom lines that Brett talked about, that without looking at that fourth bottom line that talks actually about the people and about the human capital. So is it not time that we this help define, this comprehensive integrated shared value strategy defined our matrix, the way we measure progress and the way we measure the returns on the investments that we've made as a company? Is it not time that the value system within our organization was defined by everybody, all the stakeholders, our customers, our CFOs, the board, the shareholders, etc.? Is it not time that we worked more closely with other corporations and institutions, as well as government and NGOs, in defining this reporting and how we are actually going to achieve and work for results, and how we are going to invest, including investment in people? Is it not time that we ensured that action and accountability is not just limited to the area of financing and profit, but is also is also assigned to the areas of the quality of human capital and the health of the communities in which we operate. So that when we talk about the cycle of action and accountability, and when we talk about the service and delivery teams, we are not just talking about the service and delivery teams that are delivering the product within the organization, but the service and delivery teams that are delivering health that ensures that our human capital is able to deliver the products that we are manufacturing. So my point here is that the shared value matrix that we need for the SDGs, that we need going forward to build a more profitable society, that is not just going to create jobs and enable everybody to attain self-actualization, but that is actually going to ensure sustainability of the corporations that we work in, and the governments and the societies that we live in, must be as a shared value matrix that must be integrated into the way in which we work. It must be integrated into the way in which we interact with our communities and with society, must be integrated into the way in which we report and into our accountability frameworks. That is my take on the SDGs and the type of shared value that we're talking about. So what type of sustainable result do we want? We want a sustainable result that is defined within the strategy at corporate and national level, but that is also aligned with the other players at national level, not just within your corporation, but within your industry and sector, and also within the broader community at national level. And the same thing at regional, the same thing at global level. In conclusion, my feeling is that when we talked about shared value, we are not just talking about the profit that you are making, whether it is the first, second, third, or fourth bottom line. But we are talking about building a civilization that will not be threatened by instability. We all know what happened with the HIV/AIDS epidemic when it hit the end of the last century. We know what happened recently with Ebola, that this level of insecurity that comes with health crisis destabilizes economies, destabilizes companies, destabilizes life, and sometimes irretrievably. At certain levels, irretrievably. And Franklin D. Roosevelt said, if civilization is to survive, the civilization that we are trying to build, we will not be hearing of security threats and instability, whether it is caused by lack of security or by ill health or by famine and poverty. That civilization that we are seeking to build, if it is to be built at all and if it is to survive, it must cultivate the science of human relationship. And I would like to argue that what we are talking about here today is the science of human relationship, the ability of every person and every element of society to live together in the same world at peace and to interact in a productive manner. Thank you.
Well, I think you have single-handedly captured what this conference has been about with 3 values. I think you've brought strength to your presentation, to your talk, and how you describe the scope of your job. I think you've described balance, incredible balance between science, resources, and human capital. And the other thing I think that you've brought that I would like to see taken from this room by everyone is a fearlessness. When you work for that many politicians and leaders, I think the appropriate word is prayer. And with that, I'd like to open it up to questions. Do we have time? Okay, but again, thank you all, panel. I think you've brought many dimensions, but I think you've really helped set the pathway and direction that we need to go as a group looking at this topic. Thank you all.